Welcome back to the IBD School Basics series. This episode, IBD School 106, looks at common concerns about surgery in IBD. I would like to introduce my colleague, Grace Elta, a professor of medicine and past president of the American Society of Gastrointestinal Endoscopy, who sees many patients with Crohn's and colitis as part of our IBD specialty group.
Welcome back to the IBD School Basics series. This episode, IBD School 106, looks at IBD surgeries. Over a lifetime, about 3 out of 4 Crohn's patients will have surgery. About 1 out of 3 colitis patients will have surgery. When your doctor mentions to you that surgery is an option, they are doing so to let you know that this treatment may be the best thing for you. In most cases, surgery will enable you to be symptom-free for a long period of time. For those patients with constant flare-ups, daily pain, and frequent trips to the bathroom, surgery can be a real blessing. What's more, in many cases, certain medications can be taken that will keep you in remission and symptom-free for a long period of time.
I just learned I have Crohn's disease. Does that mean I have to have a colostomy?
Thanks for your question. The subject of having a colostomy comes up a lot when we talk with IBD patients. What I think is most helpful to know up front are the types of surgeries we use today for patients with Crohn's disease and how they differ from colitis patients. So as we go through these surgeries, keep in mind that we're talking about Crohn's disease here, not colitis. Although Crohn's disease is primarily a disease of the small intestine, it can affect the large intestine or colon as well. Sometimes the disease causes a stricture, a narrowing in the small intestine. These strictures can block the passage of digested food through the small intestine. Imagine a very flexible hose that water is running through from the nozzle to the opening on the other end. If you decrease the opening anywhere along the way, the water backs up on the intake side of the hose. Notice how it is swollen up? Such is the case for Crohn's patients that develop a stricture. Often the small intestine will expand on one side, causing a bloating look from the outside. What's more, the section of normal bowel compensates by pushing against the strictured area, causing severe crampy pain. When this occurs, there are a few procedures that will in most cases relieve these symptoms. One of these is called strictureplasty. The plasty part of the word just means a surgical repair. So a strictureplasty just means the surgical repair of a stricture. A strictureplasty widens the strictured area without removing any portion of the small intestine. The surgeon makes a lengthwise incision along the narrowed area and then sews it up crosswise. The strictureplasty eliminates the blockage and ends the pain it caused. If a stricture is too long or there are multiple strictures close to one another, it may be necessary to remove the affected section of the intestine. This is called a resection. The two ends of the healthy intestine are then joined together in a procedure called anastomosis. Let's take a minute to translate this word. The ana part means against. A stoma is an artificial opening created by surgery. The osis part means process. So an anastomosis is the process of creating openings through surgery and joining them together against one another. Anastomosis and resection really talk about the same thing. A bowel resection may offer patients many years of symptom relief. Of course, it doesn't cure the disease. And we often see Crohn's problems return near the site of the resection. About 1 in 4 adults with Crohn's disease will develop a fistula or abscess during their lifetime. An abscess in the bowel is much like an abscess on the skin or in another part of the body. It's a tender mass filled with pus from an infection. An abscess must be drained. This can be done with a needle inserted through the skin, which is guided to the correct location with the help of a CT scanner. In other cases, surgery is required to drain the abscess or to perform a resection. A fistula is an abnormal tunnel that may lead from an abscess to a different hollow organ or to a different location in the same organ. So a fistula can connect 2 different loops of intestine or might connect the intestine to the bladder, the vagina, the skin, or other organs. Fistulas are usually initially treated with medication. But surgery may be required if the fistula is causing symptoms that don't respond to drugs. The surgical procedure is resection of the involved bowel.
But you still haven't answered my question about a colostomy.
Thanks for your patience. As I hope you have seen, there are many surgical procedures for dealing with isolated problems in the digestive system of a Crohn's patient. However, some people with severe Crohn's disease don't have isolated problems. Their Crohn's disease has progressed to the stage that it affects the entire colon, the entire large intestine. In this situation, we may need to remove the colon. If the rectum is unaffected by the disease, it may be possible to join the end of the small intestine to the rectum. This allows the person to continue to pass stool in a bowel movement. The term we use is colectomy. The col part of the word refers to the colon. The ectomy part of the word means surgical removal. Usually this procedure is done in stages. In the first stage, we do an ostomy, an opening to the outside. In the final stage, we create a pouch at the end of the small intestine to hold waste temporarily. Because it's shaped like a J, we call this a J pouch. This pouch is connected to the outside through the anus, and the external ostomy is closed. In the example I just talked about, the colon was affected, but not the rectum. In some patients, and here I'm finally getting to your question about an ostomy, the rectum is affected as well. In this case, we may need to surgically remove both the colon and the rectum. We call this a proctocolectomy. Adding the procto part to the word colectomy gives us a word that means surgical removal of the rectum and colon. A patient with a proctocolectomy needs an artificial opening to remove waste coming from the small intestine. This artificial opening, called a stoma, is usually created in the lower abdomen on the right-hand side below the belt line. An external bag is worn over the opening to collect the waste, and it must be emptied several times a day. Clothing can be worn normally with minimal adjustments. By the way, no one will know you have an ostomy unless you tell them. We call this procedure an ileostomy because it creates an opening or a stoma from the ileum, which is the last part of the small intestine, to the outside.
Okay, I have colitis. So what types of surgeries might I expect?
A bit fewer than 1 out of 3 patients with ulcerative colitis will end up having surgery, where medications alone are just not enough. Colitis, as you know, affects only the colon. Surgery for colitis involves taking out the entire colon and typically using a J-pouch procedure so you can pretty much go to the bathroom just like anyone else. This is the same J-pouch procedure we talked about earlier.
But the doctor said that my colitis was just in a small portion of my colon. Why not just remove the bad part?
That's a really good question. And if we were having this discussion years ago, that's exactly what we might have done. What we have found out is that this just doesn't work. Patients end up having multiple surgeries, with the final result being that eventually the entire colon is removed. And for the patients with colitis and not Crohn's disease, removing the colon removes the disease. I don't call it a cure because we've not returned the body to its normal state. But it does mean that your colitis is eliminated. I can tell you that from the patient's point of view, it surely makes them feel like a cure. Sometimes surgery is the last resort, but there are times when surgery is performed earlier, before all the possible complications of IBD have happened. Your doctor and you are both looking for the same outcome, for you to achieve the best health possible. As with all the options you'll discuss with your doctor, ask questions, consider the risk both with and without surgery, and learn all you can about what's being recommended. In our next episode of the IBD School Basics series, we'll look at non-surgical treatments for IBD medications. Thank you for your attention.